Hi everyone, just a quick video about Module 7 because there's a lot of information in there, so be sure to be reading the articles and the chapters, but I wanted to do a quick wrap up of it. Module 7 is about ending groups and different factors and processes you might see to end a group. And while ending any therapeutic relationship can be full of emotions, both for the group members and for the practitioners on an individual or group level, it's important to remember that you need to carry the same values and ethics and be the same person you have been throughout the life of the group, especially. Just because the group is ending doesn't mean that our boundaries go away or that any rules disappear or that we're blurring the lines of our ethics. And one student recently shared with me, and I don't think that they'd mind that I'm sharing this, but that a client finished group treatment and a practitioner gave the client a card and a little gift for a successful completion. The student and I then talked about some ethics regarding this end, and some of my questions were if this is common for all group members when they finish the group, if the practitioner paid for this gift, or if some items are readily available for completion as a token of celebration for completion, as well as if the group member could interpret this gift as friendship rather than a professional setting. Some of the other questions I might think about is what happens if the other group members don't receive the same at the end of their treatment, especially if this is an open group. So this was a really good example that was brought to my attention at the perfect timing that demonstrates some of the difficulties in ending group work, but also ethical questions related to boundaries. It's important to know that with different types of groups, there are different endings, whether that means the way the group ends or the time that the group ends. So for a task group, it might be that the solution was found and that the task is now over. Therefore, the group no longer has a purpose. In treatment groups, the changes or the time frame may be over and there might be follow-up plans made. So for example, if a person is in a group at a mental health hospital, the inpatient group's treatment may be ending due to the patient stabilizing, and follow-up plans for outpatient individual treatment may be made. With open groups, it can be difficult since everyone may be on different time frames and treatments. So with that said, it's important to recognize progress of different individuals within the group as a whole. It's important to normalize among groups that this is a topic of discussion. So something like, today is Sally's last day. Sally, tell us how you're feeling. And then after Sally tells you how you're feeling, contributing this conversation to the group. How is everyone else feeling about when their day comes that it's the last day in the group? And that can really tell us a lot. Are there other anxieties of the group members when their time for the group comes to an end? And it can really be a good opportunity to further address before their end time comes. So maybe you wrap up that day with saying, the next meeting we're going to be talking about other worries about the group ending for the rest of the people. It's important to remember, too, that the end of the group is going to be positive for some people but negative for other people, especially negative if this group is maybe the main support system for that person. With mandated clients, this might be a welcoming, happy time to come, but for all, we should consider some of the important ending factors, no matter the situation that the client is in. With the example I shared previously about gift giving at the end of treatment, I think that's a factor to consider too. If for that particular client, that end sounded like it was a celebration, but for another, it might be a very scary and concerning time. So is a gift the best way to celebrate for all? Probably not. Keeping in mind that we should address members equally too, and there might be a better end to remain professional towards all rather than gift giving. When very personal information is divulged during groups too, group members might be especially worried about ending group and concerned about maybe who they can be vulnerable with next after leaving the group. If you're in a situation in a group that you're noticing that many people are prematurely leaving the group before a true end or termination, it would be recommended to look at some of the other factors as well impacting the group members, because research does tell us it's fairly uncommon for several group members to prematurely end without a formal termination. Is there a strain of COVID going around the group? Is there a poor relationship between members and the group facilitator? Is there some other concrete barrier in the way that isn't allowing the group to be successful? In my area, for example, the local cab company during COVID stopped running for several hours of the day, making transportation assistance for clients very, very difficult. And so if this is something that happened in your community or in your group, you might have to take other steps, such as setting up a corporate Uber account or doing telehealth sessions instead, but being sure that you're being mindful of some of those other factors rather than feeling like people are just stopping showing up. There can be also relationship and group dynamics, especially if there's conflict in the group that could contribute to an early end. So again, important to be mindful of that and checking in about some of these factors or concerns that can contribute to premature ends to groups. Ending of groups is a vital time where we should have special attention paid to ethics. In using language or phrases to end a group, this is something that I think all of us, especially newer workers, maybe need to practice or are nervous about. For one, something that seems to always happen is that there's a new topic of discussion being brought up prior to the end of the meeting that day. And sometimes it's really difficult to redirect members, especially if they're bringing up a big, heavy topic when there's 4 minutes left in the group. It can allow for kind of an awkward ending, and we don't want people to feel like we're cutting them off or we don't care, but there is a time limit oftentimes that we need to be mindful of. We don't want to end a session when someone starts talking about a new concern, so it's important to be mindful of phrases to demonstrate the end and addressing it if someone does bring up a heavier topic towards the end. This idea can account for the end of a single session as well as the end of a group as a whole. So in general, it's recommended to do a quick review of the progress that's made, highlight the significance or give a takeaway, something the members can do with them that day and incorporate into their lives, and be able to address new concerns that may arise for next session or further referrals. And you might see that referred to as a parking lot technique. Finally, evaluating progress is an important part of the end of any work we do with clients, individuals, or groups. And we could talk about this all day, but I'll keep it pretty brief. The same we do in an individual practice is the same for groups. We want to know if the interventions and the time we spent together was effective, so we know if they have a chance of being successful after this, or if we really need to modify what we're doing for the best outcome for the clients. Every person does find success a little bit differently in some ways, so again, back to that idea of paying attention to individual members of the group's progress is important. There are specific examples of evaluations in Chapter 14 of the Toseland-Rivas book, so if you're looking for specific suggestions, please make sure you're reading that. I am going to post 2 other little videos, just some examples of how to phrase ending of a task group, something we might see more within our agency with our coworkers or other groups, and then also an example of a parking lot technique example, so parking a conversation until the next group comes. If you have any questions, please feel free to reach out to me.